Hi, I'm Dr. Atanasovski, the medical dermatologist here at Allure Medical Spa. I want to take a few minutes to show you how to do a self-skin check at home. Now, May was Melanoma Awareness Month, so this month I want to feature how to do a self-skin check at home on your own moles. I have my patient Alyssa here, and I'll demonstrate how I would do a skin check on her at home. So she's got a couple moles that are concerning her, so we'll take a look at those. Alyssa, can you show us where your moles are?
I have one on this side right here.
Okay.
On this side, and then I have another one over here.
Okay, so first we'll start with this mole here. So you can see this larger mole here on the left side of her neck. So there's 5 basic key points that we want to review for how to do a self-skin check at home. So the first step is A, and it stands for asymmetry. So any mole that cannot have a mirror image is one that we want to focus on. So what we're looking at with this mole as far as asymmetry goes is if we cut this mole in half, would we get a mirror image on either side? And I think we would. It is nice and even and round. So this one looks great as far as symmetry. The next rule is B for border. So if I were to take a circle around this mole, it is nice, even, and smooth. You want to be concerned with a mole that has little projections. They might look uneven or asymmetrical in the areas. C is the third step, and that is for color. What you're going to be looking at is a mole that has more than 2 colors, or if it has pigment in one side of it that is not present on the other. So if you have a small dark section or an area that doesn't have any pigment, that's what you should be concerned with and bring to the attention of a board-certified dermatologist. The fourth rule of thumb is D for diameter. So the typical template is about 6 millimeters. This mole fits within the 6 millimeter parameters and is nice, small, and is not worrisome as far as that aspect goes. Larger moles may have an increased risk of being abnormal, but you can check those and make sure that they're not growing, which leads us into the last step, which is E. E stands for evolution or enlarging. So any mole that you've noticed that is changing, growing, bleeding, then that is also a concerning feature. Alyssa, has this mole had any of those symptoms?
No.
So now that we've gone over what you should look for as far as your moles go, I'll demonstrate to you how to do a self-skin check at home. An easy way to do a self-skin check is before you go into the shower. What areas you'll want to look for should include your face, ears, neck, chest, arms, legs, fingers, and toes, including your nails. Now for the more difficult ones on the back, so you can have someone at home help inspect your back, or you can do an annual skin check with your dermatologist, who will also look head to toe from your scalp to your chest, back, face, arms, legs, and fingertips and toes. Make sure you do this frequently at home, at least once a month, and you can see your board-certified dermatologist for an annual skin check. I usually do mole checks annually if you don't have a history of skin cancers. If you do, we may see you a little bit more frequently. So again, make sure you do your monthly self-skin checks, and thank you for watching.